So when you think about CEOs who are listening today, and they're not in healthcare, and they're listening to what you're saying, say, how do I adapt this to my industry? What are the principles behind that mindset that you think could be applied no matter who we're serving?
I think there are performance principles first, right? I think, for example, and hilariously, unfortunately, healthcare doesn't apply to any industry, right? You can see that even in the way the stock market is melting. Many stocks have gone down. Health tech is down by 90%, right? Which makes you wonder what in the hell has been happening in some of these companies all this time, right? But I think performance metrics are a really important principle. Anybody who's a CEO of a company is looking at, are we actually delivering on the job that we said we're going to do? And what I think healthcare and folks in healthcare are too far away from, strangely, is whether or not the efforts they're making are actually working. To give you an example of what I mean by that, if you look at health insurance companies and their trust metric, do patients actually trust that their health insurance is doing the right thing for them? It's pathetically low, like 17%. Some have an NPS scores of negative numbers, right? Pathetic, right? So in other industries, this would be totally unacceptable, right? In other industries, that CEO would be fired if you couldn't even build a trustworthy product. Another example would be outcomes. So you have health insurance, you have a doctor, and yet you're not getting better, right? You missed a screening. Every year a woman needs to get a mammogram after the age of 50. And if she doesn't, it could be catastrophic for her. She could get cancer, it could have spread, she could be sick, need chemo, and unfortunately die, right? These are outcome measures that every industry has. And the way our industry is set up, you really only need to look at those outcome measures once a year. What? Right? Medicare sets up what we call STARS ratings. And every patient, based on their age, needs to follow guidelines to make sure certain measures are taken care of. 1 time a year, 2 times a year. That's just not how healthcare works, right? Maybe you didn't have breast cancer this year, but next year you do, right? You can't drop the ball. And finally, I'll say, COVID was catastrophic to so many industries, right? And we're still living the supply chain issue and whatnot. But in healthcare, people just stopped seeing their doctor completely. They just didn't go for 2.5 years. Their disease state spread, they have new diagnoses, they stopped taking their medications, their mental health went, you have seen by the, dozens of mental health startups. Mental health was a huge issue during the pandemic and maybe slowly improving. There was no preparedness. Again, any CEO prepares for eventualities. Hilariously, Heal was prepared. We were right on the money for a pandemic, right?